Hello everyone. So a lot of you will be in the counseling phase of NEET PG, although the counseling is delayed. Today we will discuss what are the merits and demerits of taking MD medicine. And merits may we will not discuss much because merits तो आप सबको पता ही है. That's why you must be like considering this as your option. So merits में the thing can be that it is more relatable branch to your MBBS. Another thing is that you'll get the feeling of being a doctor who can treat all the ailments. जैसे बहुत सारे लोगों को ऐसा लगता है कि they are the first generation doctor in the family. So like in the family everyone wants them to be a MD medicine person like that, and you will be having the satisfaction of saving a life in the emergency, like treating arrhythmia or something. So these are some of the benefits apart from others. But today we'll discuss why not to take MD medicine. What are the demerits of taking MD medicine as a branch? The first and most important thing is कि until unless you are planning to like settle in a small city or a tier 2 city, करना DM करना is a must thing now, because like in metro city people what they do is कि they directly go to a super specialist. They know कि now I'm having a heart problem, I have to go to a cardiologist. I'm having a GI problem, even for like small problems like dyspepsia or something, people go to a gastroenterologist. Okay, so these kind of things are there. So people tend to go directly to a super specialty. Unlike US में ऐसा है कि you have to go to MD medicine person, then he'll refer you to a super specialist. But in India, it's like you can directly go to a super specialist. So everyone wants to go to a super specialist. So that is one drawback. Another drawback is कि DM कर निकालना is not that difficult until unless आपकी कोई branch preference है, as in someone wants to take endocrinology or rheumatology per se. So in branch में there is some competition, otherwise DM निकालना is not that difficult, but करना is very difficult. Why so? Because MD medicine जब आप करते हो, you spend your 3 years, like three peak years of your life in the branch. So ठीक है, first time में करना it's difficult. Anyhow it's difficult, the branch is difficult, the working hours are very much, you have to study a lot. But still first time करने में you will have this feeling कि you are doing something for the first time, तो उस craze में you tend to do it. But second time करना the same thing कि first year की toxicity काम झेलना, then second year में thesis करना, and again you have to study. So वो चीज same repeat DM में करना along with like facing the department toxicity is a little more tough. It's like preparing for NEET PG once is much easier than preparing again. So you have to do the same things again, and now you know what are the bad part about doing these 3 years. So that is one you know drawback of taking MD medicine as a branch. Another drawback is since it's a like more of a logic based and treatment based branch, so intervention is very less until unless you will take some intervention branch in DM like DM cardiology or gastroenterology. So it's the intervention is less, the skill based things are less. You'll have to gain a lot of knowledge and you have to apply that knowledge and use a lot of logics. So जिन लोगों को भी there is some interest in doing some interventions or some procedures or some surgery, so there is the lack of this thing in MD medicine. The max to max you will be doing a central line insertion or lumbar puncture or a intubation, and that too अगर आप एम्स में या सेंट्रल इंस्टीट्यूट में जाते हैं तो these things are done more by a anesthesiologist. So that is one drawback. Another thing is कि MD medicine में the main things were emergency and ICU. तो अभी क्या है कि ICU is taken care by a anesthesiologist and emergency medicine is taken care by emergency medicine personnel. So अगर आप MD medicine ही रहते हो plain, you won't go to the DM. तो ये जो आपका core area of like practice था, private practice, वो काफी हद तक covered by anesthesiologist and a MD emergency medicine. So that is one drawback. Another drawback is कि the learning earning would be late, like if you will be doing DM also. So that too will take 3 years of your life, and other than that like in intervention branches you will have a long curve, and per se in other branches too earning is low as compared to radiology and other surgical branches. That is one drawback. And the last thing is there is a lot of mortality in MD medicine. Like if we will be taking branches like ophthalmology, ENT, surgery, or even because mortality is taken care, like surgery may generally take elective patients and all, but MD medicine have to take all the patients in the department. So even like frail, sick, old patient or a stroke patient or MI patient. So there's a lot of mortality. Like in our emergency, we used to see at least 10 to 15 mortalities per emergency. So you have to face a lot of mortality. You have to like be mentally prepared for that. Along with that, you have to break the bad news to the attendants of the patient. It is also a big deal, especially in government setups and especially in non-central institutes and non-Delhi institute, because there is a lot of fuss created by the attendants there, and you are more prone to get attacked by the mob. It is also one thing. And another thing is since the workload is very heavy, and especially in the first year of your PhD, the workload you have to like spend 3 4 continuous days in your ward, and you have to study again more in the second year or third year part. So the department toxicity is somewhat more in the branch because it's also because of the amount of work that you have to do. So since the amount of work is more, the toxicity will be. So that's all. And if you are really interested in MD medicine and you are willing to face all these things, it's a wonderful branch. I'm not like demotivating anyone to take this branch, but yes, just don't take this branch because you just heard from somewhere, or you just think it is cool, or you just saw House MD and you just think it's very cool to use logics or something. It's come with some of its demerits as well. So if you're willing to take this, take the branch. All the best.